A warm welcome to my dear friends. Welcome to my channel. So in our previous class we have discussed about axillary artery parts and its branches. And today we are going to discuss about the relations of axillary artery. So what are the three parts which we have discussed? The first part, second part, third part. First part which is present above the pectoralis minor. Second part is present under the pectoralis minor. Third part is present below the pectoralis minor. So these relations, these three parts relations that we are going to discuss. And before going to explore this video, please subscribe to my channel. And let me complete this axillary artery, the parts and their relations. So coming to this axillary artery, the three parts and relations. So first we must know that here's a quick review. Okay, so it is a continuation of the subclavian artery. So from the outer part of the first rib, the subclavian artery, it is extending as axillary artery, and this axillary artery along with the axillary vein and the cords of brachial plexus, all these things they are passing through the apex of axilla. That's why that apex is called as cervico-axillary canal. Cervico-axillary canal. Then this axillary artery which is extending into the axilla, and then it is reaching to the lower part of the teres major, and then from here it is extending as the brachial artery. So that is about the commencement and the ending of the axillary artery. Now we are going to see the three parts. First part above the pectoralis minor, second part under the pectoralis minor, third part is present below the pectoralis minor. And now the relations we are going to discuss. So what is present anterior, what is present posterior to the first part of axillary artery, and second part and third part that we are going to discuss. So let us discuss about these three parts. Now we are going to discuss about the relations of first part of axillary artery, second part of axillary artery, third part of axillary artery. So please practice this diagram so that it will be easy. Yes, this is medial view and this is lateral, this is anterior and this is posterior view. So first part which is present above the pectoralis minor, that we are going to separate it, and we have taken as transverse section and try to observe from above how the structures are present. So here you can see that this is the axillary artery, the first part of axillary artery. So throughout its course, the axillary artery, it is related to the axillary vein medially. So try to see, this is the axillary artery and medial to this is axillary vein. Now what are the structures are present anterior? Now let me show you all the structures which are present anterior. So first and foremost thing is skin which is present, and most anterior is skin. Then underneath the skin, which we can identify, this is superficial fascia, and this superficial fascia which is consisting of supraclavicular nerves and also the platysma muscle fibers which are extending. Please write down all these relations from anterior to posterior. First this is skin and this yellow color one is superficial fascia, and then underneath the superficial fascia which we can identify the muscle called as pectoralis major. So this is the pectoralis major muscle fibers, and the pectoralis major, it is covered by the fascia called as pectoral fascia. You can write another name which is present just below the superficial fascia, that is pectoral fascia. And underneath this pectoral fascia we can identify pectoralis major. So these are the relations. And what are the other relations which are present anterior to the first part of axillary artery? So there is a loop between medial and lateral pectoral nerves. So here I have just drawn a loop. That loop is formed by this is the, and here you can see that this is the lateral aspect, that is medial aspect, right? So this is, here you can identify medial pectoral nerve, and here lateral aspect, so it is lateral pectoral nerve. lateral pectoral. So this is a loop which is present anterior to the first part of axillary artery, anterior to the first part of axillary artery. And also there is a communication, there is a cephalic vein which is running from laterally, and then it is also running anterior to this first part of the axillary artery. This is the cephalic vein, and this cephalic vein, it is running towards medially, and then it is piercing the clavipectoral fascia, and then it is draining into the axillary vein. And also here you can identify thoracoacromial vein is also draining into the axillary vein. So these are the two veins which are present anterior to the first part of axillary artery. Then what is present behind? So these are all the anterior relations, and what is present behind are first and foremost thing, which are first and second digitations of serratus anterior. So here you can see that this is the first and second digitation of serratus anterior muscle fibers. So you write down the posterior relations, this is second, and this is first. So these are serratus anterior muscle fibers, and then so it is they are receiving the nerve supply which is coming from C5, C6, C7 segments. That nerve is called as long thoracic nerve. And as I told you earlier, entire apex is passing the axillary artery, axillary vein, and the cars of brachial plexus. So what are the other relations of this first part are? So it's also related to the cars of brachial plexus, and as we have discussed earlier in our previous class also we have seen that. So what are the relations of the brachial plexus? I'm just erasing a small part of the cephalic vein in order to show clearly the cars of brachial plexus which are related to the first part of axillary artery. Okay, so here this is the axillary artery, and right. So we have seen the long thoracic nerve and serratus anterior muscle fibers, and what about the cars of brachial plexus? So posterior to the first part of axillary artery, we can identify the medial cord of brachial plexus. So this is the medial cord of brachial plexus, and this side is lateral, right? So laterally you can see the two cords are present. One is lateral cord of brachial plexus and the posterior cord of brachial plexus. Okay, so try to remember lateral cord and the posterior cord which are present lateral to the first part, lateral to the first part of axillary artery, and posterior to the first part of axillary artery we can identify is the medial cord. Write down, this is the medial cord, and this is posterior cord, and this is lateral cord. Okay, LC means lateral cord, PC means posterior cord, and MC means medial cord. So these are the relations of first part of axillary artery. So once again we will quickly complete these relations. Anteriorly, skin, superficial fascia which is consisting of supraclavicular nerves and platysma. Then after that pectoralis major and the fascia, pectoral fascia. Underneath it we can identify the loop which is formed by the communication between medial pectoral nerve and lateral pectoral nerve. Then after that cephalic vein and thoracoacromial vessels which are present here, thoracoacromial vein. And then posterior relations, first and second digitations of serratus anterior and the medial cord, these are the posterior relations. And medial relations are axillary vein. So this is the axillary vein. Axillary vein. And lateral to the first part, posterior cord and lateral cord. These two cords of brachial plexus which are present lateral to the first part of axillary artery. So that is about the first part relations. And now let us move to the second part relations.